Hello everyone. My name is Dr. Stanley John, Department of Oral and Maxillofacial Surgery. I'll be talking about sterilization in dental practice. This presentation is not intended as a class on sterilization, rather it is what we should do in our dental practice. We learn from second year of videos, but seldom practice it. Blaming everyone here, but yeah, me included. So it's just a basic overview of things that to refresh you once more of things that you should do in a clinic. So, healthcare associated infections are one of the most common adverse events in delivery of care and a major public health problem in our country that impact on mortality and quality of life. So, at any one point, uh, almost 7% of patients in developed countries and 10% of patients that uh, developing countries occur healthcare associated infections. Imagine a patient coming to you on the worst day of their life and they have to go home with another infection. That is simply not acceptable. So we have to take sterilization very seriously. So, and also these infections cause a significant economic burden for our system also. So, what is sterilization? Sterilization is defined as the process by which an article surface of medium is freed of all living organisms, either in spore or vegetative state. Disinfection is defined as the destruction or removal of all pathogenic organisms that is capable of giving rise to infection. Agents used in sterilization include physical and chemical agents. Physical agents, various physical agents that are used as sunlight, drying, moist heat, dry heat, filtration, radiation, ultrasonic and sonic vibration. Moist heat, the one that we commonly use is boiling and autoclaving, and dry heat is hot air oven or apartment. So, autoclave kills microorganisms by coagulation and denaturation of their proteins. So, it is mainly operated at 1 degree Celsius at 15 psi for 15 minutes. So, I'm going to roughly go through all of this. You all know this. Coming to dry heat sterilization, dry heat involves heating air with transfer of heat energy from air to the instruments. Different types include cleaning, incineration, and hot air oven. Hot air oven works by dehydration and oxidation of the proteins of microorganisms. So these work at 160 to 190 degrees Celsius. Various chemical agents that are used include alcohol, aldehydes, dyes, halogens, phenols, surface active agents, metallic salts, etc. The instruments that we use in our clinic can be clustered in three, that is critical, non-critical, and semi-critical. Non-critical instruments are our X-ray heads, pulse oximeter, blood pressure cuff. These don't directly come in contact with mucous membrane or blood. So, skin is a good barrier for microorganisms. Intact skin is a good barrier for microorganisms. So, these need only a very mild disinfectant for sterilization. Semi-critical instruments are those that come in contact with your mucous membrane, your mouth mirrors, amalgam condensers. These require heat sterilization or a high-level disinfectant. And critical instruments are those that come in contact with bone, blood, etc. The surgical instruments. These should be autoclaved, or it can be simply used sterile, single-use instruments. Examples include your surgical instruments, scalpel blades, periodontal scalers, etc. So, how do you break the chain of infection? Just primarily by personal hygiene. Should observe the following precautions. Should refrain from touching unwanted surfaces. Wear a glove, your glove hand. You should always cap it and hold it in front of your chest so that you don't unnecessarily touch surfaces. You should cover all your cuts and bruises on fingers with dressings because they serve as easy portals for pathogens. your hair, like especially women. You should cover it up and you should tie it up, and hairnet should be worn. It should lie loose. You should take care of that. Hand care when you're wearing gloves. I've seen people wear gloves over your rings, over your watches, even the religious threads that you wear in your hand. You choose to wear it, that is fine, but you have to, doing a surgical procedure, you can wear it above your elbow level. So that these should be followed. You should always wash your hands before and after treating a patient. So many of us, we treat a patient, we remove the gloves and suddenly go and start writing a chart. That is not acceptable. You go wash your hands and then continue the work. So if your hands are visibly soiled, you should use a hand washing technique, hand wash, and it should be done for at least 40 to 60 seconds. Clean things up. This is not the scrub procedure that I'm talking about, but basic hand wash technique that we should do before and after patient examination. And if it is not visibly soiled, you can use an alcohol-based hand rub for 20 to 30 seconds. And then briefly show you a video about all of the scrub technique. So you can use a hand rub if it is not soiled for 20 to 30 seconds. The various barriers you can use include gloves, face shields, face masks, and clinical gowns. And for sterile gloves can be used if it is a surgical procedure and you come in contact with blood, etc. Examination gloves can be used if there is no direct contact with blood, such because the exposure or body fluids, etc. And gloves are generally not indicated if checking a patient's temperature, taking a pulse, etc. So, here's a video on scrub technique.
This is a video summary of the standard operating procedure, surgical scrub, gowning and gloving in the dental. When undertaking any procedures within an operating theatre environment, appropriate theatre blues must be worn, along with appropriate theatre cloths. Face masks and eye protection are important. The face mask should cover the nose and mouth. If you need to open your own gown prior to scrubbing, do so by opening the outer wrap first and then carefully open the inner wrap to avoid touching the inside of the wrap or the gown. Once opened, you will need to drop your sterile gloves onto the inner wrap next to the gown. You will then need to prepare for your surgical scrub by opening the scrub brush prior to wetting your hands and place it on the side. Ensure the water runs at a comfortable hand hot temperature and steady flow to avoid undue splashing. For your pre-scrub, wash your hands and arms to the elbows with running water and antimicrobial solution. Use the 7-step method. Firstly, rub palm to palm. Rub the back of each hand with the palm of the other hand with fingers interlaced. Rub with backs of fingers to opposing palms with fingers interlaced. Rub each thumb clasped in opposite hand using rotational movement. Rub tips of finger in opposite palm in a circular motion. Using a rotational movement, rub from the wrist to the elbow of each arm. Then rinse from fingertips to elbow. Once the elbow has been reached, the hand must not go back to the other hand or wrist until after rinsing. Next, remove debris from under nails using a nail pick under running water. Ensure that you do each nail in turn and methodically. There is often debris hidden under the nails which is not visible, but which the nail pick will find. Step 2 is the scrub procedure. This will take 3 minutes. Wet your hands and forearms and apply approximately 5 ml of antimicrobial solution. Working from your fingertips down to just below your elbows, use the same 7-step method that you used for the pre-scrub. Rinse your hands and arms from the fingertips to the elbows, allowing the water to flow to remove the scrub solution. Take the scrub brush up, wet and apply 5 ml of solution to the brush side and use to scrub your nails only for 30 seconds per hand. Dispose of the brush, then rinse your fingertips. Apply another 5 ml of solution. Wash your hands and arms using the 7-step method, paying particular attention to palms, finger webs, and dorsum of the hands. This time, only wash the first 2/3 of the forearms and do not touch the elbows to avoid contamination. Wash for a further minute. Then rinse your hands and arms from the fingertips to the elbows, allowing the water flow to remove the scrub solution. Turn the taps off using your elbows and hold your elbows over the sink to allow excess water to drain. You will now need to dry your hands and arms. Use 1 towel per hand. Open the towel, place one hand behind it, and dry the opposite hand thoroughly by blotting the skin and using a corkscrew movement to dry from your hand to your elbow. Repeat with the other towel for the other arm. Do not return the towel to your dried hand and instead discard it into a waste bin. Pick up the gown from the inside surface and locate the armholes. Slide your arms into the armholes, having stepped away from the trolley to avoid contamination. Your assistant will need to tie the gown at the back. You are then ready to place your gloves. Keep your hands within the sleeves of the sterile gown and draw the sterile glove pack towards you and turn it around. Open the pack so that the gloves are facing fingertips towards you. With one sleeve-covered hand, grasp with the thumb and forefinger of the corresponding glove by the folded cuff edge, ensuring your thumb is aligned with the thumb of the glove. Using the other sleeve-covered hand to grasp the uppermost edge of the glove's cuff, stretch this over the back of your hand and straighten your fingers into the glove. Grasp both the glove cuff and the sleeve to pull the glove onto your hand. You will need to repeat this for the other hand. Make sure the gown cuffs are covered. The wraparound can be wrapped by the circulator by handing out the paper tag with the tie for the wrapped section attached. The circulator grasps the paper tag only, and the scrub practitioner turns and then pulls the tie free and ties at the front of the gown. You should then keep your arms up and in front of you clasped.
So another important thing that we need to discuss is linguistic injuries. So, according to CDC, if you get a linguistic injury, you are at with contaminated infected blood, you're at a risk of averagely 6 to 30% for hepatitis B virus, 2.7 to 10% for hepatitis C virus, and a 0.3% chance of getting hepatitis HIV. The most common causes for needle-stick injury in healthcare settings are two-handed capping of needles. So you should take care of this. Always scoop the cap and close the needle. So that alone will prevent a major number of needle-stick injuries. Then unsafe collection and disposal of sharp shaves is also a major cause. So coming to post-exposure prophylaxis for hepatitis, for HIV. Uh, it should be started ideally within 2 hours, but not later than 72 hours. So exposure to body fluids such as tears, non-blood stained saliva, urine, sweat is okay. There's no significant risk. Uh, Exposure to blood-stained saliva, blood, genital secretions, CSF, amniotic fluid, rectal peritoneal or synovial fluid. All of these pose a major problem. So it doesn't matter if it is a minor cut or a small mucosal tear or whatever. You need to undergo a post-exposure prophylaxis for HIV. Currently, what is recommended is a three antiviral antiretroviral drug therapy. Uh, and follow-up should be done for at least 6 months. That is at the baseline 6 weeks, 3 months, and 6 months to ensure that there is no transmission. And prophylaxis for HBV, hepatitis B virus. Healthcare workers are at a higher risk of exposure to hepatitis B infection. So hepatitis, dentists are more commonly infected. Hepatitis B vaccine is generally administered at 0, 1, and 6 month schedules. So we all should get vaccinated. And post-exposure prophylaxis for and also booster doses should be taken 5 year interval. You should check for your titer, see what is your anti-HPV antibody level. If it is less than 10 international units per ml, you should definitely take a booster dose. So if the source is known and it is a known hepatitis patient, then you need not, if your anti-HPV antibody is more than 10 international units, you need not do anything or already being vaccinated. So if the source is unknown, if you don't know that if the patient is hepatitis B positive, that case should be considered as a hepatitis B positive patient. And further treatment should be taken. Further prophylaxis should be taken from that care worker. So when indicated, immune prophylaxis should be started as soon as possible, preferably within 24 hours. So if healthcare workers HPV antibody levels is less than 10 international units, then hepatitis B hyperimmune globulin should be given at 0.06 ml per kg as soon as possible, preferably within 24 hours. And his vaccination should be started at 0, 1, and 6 months intervals. Another major thing that we need to look into in our clinical practice is disposal of our waste. This is where we go colorblind and we throw the waste in the color of dust that we see. So, should properly dispose of waste. So your cotton waste and your body waste and beddings, all of these should go into the yellow container. And gloves, your plastic waste, catheters, all of this should be thrown into the red bag. Your white is for your needles, blades, or metallic sharps. So that should be thrown appropriately. And your blue is for your ampules, broken glass, etc. So to summarize, effective infection control strategies are designed to prevent disease transmission and must occur as a routine component of our practice. Proper procedures can prevent transmission of infections to patients and also uh, to us as healthcare workers. So, hope you all follow all of this. And, yeah, thank you. Thank you for your patience.